Hello students, welcome to SCR 110, Fundamentals of Nursing. First, what's in order is a warm congratulations. You have made it to the RN program. You've worked so hard and you've come this far to getting here into the program and starting your first semester. Now comes the challenge of you being able to hold that seat that you worked so hard, and I'm here to show you how you can accomplish that. Once upon a time, I took fundamentals and I passed. So I'm here to show you and to talk to you about what resources that are going to help you to pass the class, as well as pep talk. We'll just do a little pep talk about what to expect on your first semester. So we're gonna go over how to survive SCR 110. So as you are preparing to read your chapters and for preparing to take the exams, you have to keep in mind that the way that you studied for your previous classes, those conventional ways, they're going to change. And how they will change, you have to refocus on certain facts, on certain points, especially when it pertains to your patient. So that involves certain principles of concepts, knowing the procedures and skills, so knowing how to perform a task onto your patient. When it comes to prioritization, so that includes very important frameworks that will guide you how you should implement certain tasks. And that's also involving which patient that you need to see first and who you can safely leave for last. Protocols. So this talks about safety protocols. It talks about infection control protocols. And those are protocols in which you will need to remember and that you will need to exercise once you get into the clinical field. And that also includes you going into your clinicals. More on that later. Another thing is delegation. So that's basically passing the bucket to another healthcare person. So it can be towards a CNA, which is a certified nursing assistant, or it can be to another nurse. Now, how you pass that bucket, and depending on what's in that bucket, talking about a certain task, there's a lot of factors you have to take into consideration. It is not as easy as passing a task to the first person you see down the hall. There's a lot of things you have to think about. Applying your content. You've read your chapter. You know it from back and front. Now it's about time to apply it. Now, application is very important because it helps you from learning the content to mastering the content and how you can apply it to your patient situation. This is going to be an important factor for how you pass your exams. So now I'm going to present to you some resources that can hopefully provide you some help, especially in the application department. So I have here a list of resources. Some of these are going to be books, and they can also be very popular YouTube channels and websites that I'm sure you have seen on YouTube, and certain resources that you already have in your arsenal, so you already have in hand. So the first thing would be the first Lippincott and Davis books. So I have them right here. So these are books that provide questions and answers for preparing the NCLEX RN board exam. This is a great resource to have because you are taking the content you just learned from your chapter and now you're going to practice it with questions. So These books are my favorite. Here's another one with the NCLEX RN Q&A review. They do have it by subjects, by certain areas. So since you're working on fundamentals of nursing, so that's like the basics, that's the foundation, they do have a very good section in both of these books that you can just focus on practicing questions while making sure you don't do the questions that you're going to be working on later as you progress. Another great tool is the Saunders. Now this is another popular resource. So Saunders has a comprehensive NCLEX RN book. Same style as the books I just presented to you, the Lippincott and the Davis. And it offers a lot more. Now I'm going to share with you guys that this is actually one of my favorite resources, and I'll tell you why. So I'm going to bring you over here. When you purchase a brand new Saunders book, you'll have a scratch off code that you can just scratch off and have access to the web content, the website content. And so I'm going to bring you closer. This is one of my favorite things that I do with my study group. So going into here, and then you're going to see exam review. Click on that. Open, and this pop-up is going to show, and then you will be able to have a test bank that you can practice more questions. The Saunders already has printed questions inside the physical book, while this has a much bigger test bank that you can practice. So content area, that would be where you can go to, and it can be under foundations of care, which is synonymous for fundamentals of nursing. And you can see all the subcategories, everything from communication, which is going to be one of the beginning chapters you'll work on, to the more later chapters, which would be perioperative care. So this alone, you have 532 questions. So then you go, begin. And it's a simple online format that you can do multiple choice. It does include the next generation testing formats so that you can have exposure that way as well. And yeah, so this is one of my favorite resources because it provides an extension for practicing questions. So come over here and we'll continue the list. So that's the Saunders Comprehensive NCLEX RN books. Now some media that are also useful, that includes Simple Nursing. You might have seen him, his name is Nurse Mike, and he has YouTube content as well as a website that you can have access to videos in which he has very helpful, very colorful animation while being able to help you, teach you certain content without the fluff, right? You just want to know the most important information, and he breaks down that information very, very well. Registered Nurse RN, so that's with Nurse Sarah. She also has a YouTube channel and a website. So she goes over more of the principles and the procedures and really goes into to an extent, like she really covers every single thing you need to learn regarding your nursing class. Everything from performing dry sterile dressing and how to do that, to understanding how to study for an exam. So she covers every content that you are ever curious about or that you want to know. She covers it very well. Nexus Nursing is another favorite YouTube channel. She does a lot of practice questions while also adding in her personality, so it's very nice to be able to have that kind of connection. But her questions are very, very good, and she does provide very nice tips, very clear-cut tips on what you need to know about that question. If it involves safety that you need to know, if it involves priorities, right, that you need to know. She really tells you what's important and not what's good to know, what's nice to know, which is something that we need for passing our nursing program, our nursing classes. Now, ATI, you should have access to ATI as well as the physical books. So there's the online content and then there's the physical books. So the online content, there's also a test bank in which you can access and practice questions. There's also the physical books that are very similar to Saunders, which they provide the content in a very concise, very straightforward format. So this is a great source to have, and it's also very vital to have when you are preparing for your ATI exams. So having this along with your lecture textbook, this is a great combination and a great way to pass your exams and your class. So the next point I do want to mention is study groups. So you're sitting next to your classmates and you're all in the program. You're all sharing that same room and you're all learning the same things. So now is the time for you guys to break the ice and pair up. So you can complement each other if there's a content that you are well versed in, that you are very familiar, that another student is having trouble with, or they may do vice versa. If there's something that you're stuck on, ask a classmate. I do advise to keep it small though, because we want to make sure that it doesn't become like a bit of a party or a social event. Remember that the main focus is that you are trying to pass your nursing classes. So remember to be prepared to come to your study groups ready to work, and you want to make sure you are around others that are like-minded, that they are just as dedicated as you are on that regard. This is a very important saying that I have this with my study group, so help each other, support one another. So when it comes to being in the program, there's no more competition. You guys have earned your seat. You are in the program. You're on your way to becoming a nurse. Now is the time for you to work together. Support one another. If someone is struggling, pick them up. If that person is mastering the content, well, give them the praise. And maybe go over and ask questions. Be humble. Where a person is struggling on something, provide that help. Because this is a very important thing that you're going to experience once you get into the clinical field, once you get into your career. That the biggest thing that you are going to do is to work together. And you are working together to make sure your priority, your patient, is safe and taken care of. And that is accomplished as a tribe. And that tribe can be formed here. When it comes to the practicum, okay, the practicum is something that is part of your grade, but you're not going to be graded on it. But it is a very important assignment that you'll have to accomplish, in which you will have your professor tell you in further detail, but basically there's going to be some skills, some procedures you will have to perform in front of an observer to make sure that you're well competent in performing that skill safely, right? So there's going to be some guidelines and some criteria, grading criteria that you'll have to make sure you pass and that you perform well. So I stress, practice, practice, practice. And you can have practice time at the nursing lab. Just come up to the nursing lab here that's with Barbara or with Farah and just ask that you are interested in practicing a skill or preparing for your practicum. When can I come in and how can I come in and how does this all work? And they will help you with every step of the way. So I do stress, please practice. That practicing, it guarantees passing. And you should also have access to videos. There's 3 main videos in which you will do one of the skills. So whether you may do dry sterile dressing or administering an injection through intramuscular or subcutaneous. You may not know what that is right now, but you will so soon learn. But there are videos now that you can view on your leisure time in preparation for the practicum so that when you come for performance, that you know what to do and that you are able to pass. The last thing I want to cover is clinicals. Now, you are learning all this content in lecture. It is now time to apply it to your field work. This is the time for you to participate, to volunteer, to apply what you're learning, to practice, to have it tangible in your hands, to work with patients. So this is the prime time for students, for yourselves, to prepare for when you are going into the field. So take advantage of the time that you have in clinicals so that it prepares you for not only for performing in class where you're applying what you learned in the textbooks to what you're learning with your hands, but to becoming a competent nurse. And so that's all the tidbits, all the sources, all the little information I can provide. What I want to say to you is best of luck and work hard and stay humble and just keep the faith that you will pass. Thank you.